Thank you. At this time, I'm going to call to order the Assembly Health and Human Services Committee. It is 1:34. Madam Secretary, will you please call roll?
Assemblywoman Benitez Thompson.
Here.
Assemblywoman Black.
Here.
Assemblywoman Gorlow.
Here.
Assemblyman Hafen.
Here.
Assemblywoman Krasner. Assemblyman Matthews.
Here.
Assemblyman Orentlicker.
Here.
Assemblywoman Peters.
Here.
Assemblywoman Summers Armstrong.
Here.
Assemblywoman Thomas.
Here.
Assemblywoman Titus. Chair Wynn.
Thank you. And I see a note here from Assemblywoman Titus. So if we can just mark her, show her present when she arrives. I think she is somewhere else right now. So I know that she is running a little late or is presenting in another committee. So we can do that. And the same thing with Assemblywoman Krasner. At this time, I'd like to welcome our audience to join us for this virtual meeting. Today, we have 3 bills, including the first one that I'm going to present. So at this time, I'm actually going to step out of the chair role here and go down to the virtual table to present the bill, and I will turn this meeting over to our Vice Chair Peters.
Thank you, Chair Wynn. We will begin the hearing on Assembly Bill 358. This bill enacts provisions to improve access to Medicaid for persons released from incarceration. Assemblywoman Wynn, please begin when you are ready.
Thank you, Vice Chair Peters and members of the Health and Human Services Committee. For the record, I am Assemblywoman Rochelle Wynn, and I represent Assembly District 10. And I'm here to present for your consideration Assembly Bill 358, which improves access to Medicaid for people who are recently released from prison. I had actually submitted a Health and Human Services Committee bill that did the same thing. So when I saw that Speaker Frierson had also submitted this bill, I like to think that great minds think alike. Today with me, I have Richard Whitley, who is the Director of the Department of Health and Human Services, Suzanne Bierman, the Administrator of the Division of Healthcare Financing and Policy, as well as Richard Thompson, the Deputy Administrator for the Division of Welfare and Supportive Services. And they will be helping me with the presentation today. But by way of some background information, I just wanted to give you a little bit of information about the intent of Assembly Bill 358. It is to improve care transitions to the community for incarcerated individuals who are eligible for Medicaid. And let me give you, again, some background. Individuals that are incarcerated often have significant physical and mental health care needs. For example, they may experience chronic and infectious diseases such as hepatitis C. They may suffer from severe mental health and substance abuse disorders, and some of those physical health issues associated with mental health and substance abuse disorders. And they occur at a much higher rate than our general population. The COVID-19 pandemic showed us how vulnerable many of these individuals are, and many suffered from this horrible disease while incarcerated when we had severe outbreaks in our prisons. We want to improve the health care for individuals who are recently released from prison. So this action and this bill will help improve health in our communities, lower spending of state health care, and also potentially advance public safety goals such as successful reentry and reduced recidivism. Currently, we have many individuals in our criminal justice system who do qualify for Medicaid, especially since Nevada expanded eligibility for lower income adults through the Affordable Care Act. Medicaid has a key role in providing support to these individuals. And as you know, people are incarcerated. They're often disproportionately poor and people of color. This bill also helps create and address some of those healthcare inequities while advancing healthcare and racial equity in our state. As of 2019, 43 states, so we would be asking to join those 43 states, that already have a policy or have enacted policies that suspend Medicaid eligibility for an individual person while in prison. And 42 states had a policy to suspend eligibility for an eligible person while they are in jail. 6 additional states are considering this policy in 2020, including us here today with Assembly Bill 358. Again, this bill provides that same policy to suspend Medicaid while someone is incarcerated rather than terminate them from Medicaid when they are sent to prison. At this time, I'm going to give you kind of a brief summary of some of the sections, and then I will turn this over to some of my co-presenters who have been working in this field and know it inside and out. So Section 1 of the bill requires the Department of Health and Human Services to suspend, again, rather than terminate Medicaid eligibility of an individual who is incarcerated. If an individual is not eligible for Medicaid, or if that eligibility was terminated prior to incarceration, he or she can now apply for Medicaid up to a half a year before his or her scheduled release date. And I'm sure my presenters will also talk about the cost savings that we will have in order to get them in there, as well as the continuity of their medical care upon their release from prison. Upon their release from prison, the department shall reinstate or institute eligibility for and coverage under Medicaid to a person as soon as possible if the person otherwise meets eligibility requirements at that time. Section 2 of the bill requires that the director of the Department of Corrections to complete the Medicaid application paperwork for an individual who is incarcerated as soon as practicable after the individual is authorized to enroll in Medicaid as outlined in that Section 1. As you can see, the bill's provisions aim to improve access to Medicaid for a person who has just been released from prison. Ideally, a person will have Medicaid coverage on the day of his or her release from prison without any gaps in that coverage. Again, currently we have about 19,000 people incarcerated in our state prisons, and we need to find a way to ensure the continuity of healthcare coverage and provide relevant social services for those who are incarcerated and transitioning back into our community. Connecting these people to Medicaid early on can facilitate their integration back into the community by increasing their ability to address their health needs. This bill will contribute to greater stability in their lives and provide broader benefits to all of our communities and help reduce recidivism within this population. I urge you to support this bill. And Madam Vice Chair, now with your permission, I would like to turn over my time to Director Whitley and his staff for additional remarks.
Thank you. Please, it looks like we have Director Whitley. Please go ahead.
Thank you. And thank you, Chair Wynn, for the opportunity to speak on behalf of this bill. DHHS does see this as good policy. If you look at, I guess, for evidence of why legislation is needed, if you go to dhhs.nv.gov/analytics and scroll down to the Corrections Outreach Dashboard, we actually have been collecting for some time information on inmates that are being discharged and then matching it to identify if they've been enrolled in Medicaid. And we don't do a good job. We definitely can do better. I think we do a good job in our detention facilities in Clark and Washoe County with getting inmates that are leaving enrolled. But we could do better in corrections. And so this legislation, we do feel with the combination of enrollment and suspension will go a long ways to make those improvements. I think the chair also identified the benefits, the continuity of care being the big one. Many of these inmates are stabilized while with chronic health conditions, whether it's serious mental illness, HIV, other chronic health conditions. They're stabilized while they're incarcerated. And so to continue that care upon discharge could really dramatically support their continuity of care. The other element is the Department of Corrections currently pays for, with general fund, 30 days worth of discharge medication. And we believe there would be a savings by the enrollment in Medicaid upon exit, the day they leave, they would be enrolled in Medicaid, and that pharmaceutical cost could be covered, drawing down a federal match for that, which would result in a savings for the state. So those are the two drivers. The third is we currently have a contract out for our managed care in Nevada. You might recall from presentation from Administrator Bierman that in the urban areas, Clark and Washoe, Medicaid primarily utilizes a managed care model. We've included in the RFP for managed care a highlight of the criminal justice involved population, with scoring actually on strategies for transition to be included in the response. And so that RFP is currently out, and we are very much looking forward to innovations from the managed care companies to assist us with the transition from facility to community, and we'll be scoring those applications based on the response. And so that concludes my remarks on this bill. Again, I think it's good legislation, and I have with me Administrator Bierman and Deputy Administrator Thompson from the Welfare Division to answer any questions.
Director Whitley, do they have any, I'm sorry, Rochelle Wynn for the record, do they have any presentation to make or just here to answer any questions?
For the record, Richard Whitley, they're just here to answer questions.
Perfect. With that, Vice Chair Peters, we are ready for any questions the committee might have.
Thank you, Chair and Director Whitley. I do have a question from Assemblywoman Chandra Summers Armstrong. Excuse me, before we go into questions, though, I did want to make for the record, make sure the Secretary knew that Assemblywoman Krasner has been here since we started the committee. She just had mic issues, so if we could just mark her as present, please, that would be great. Assemblywoman Summers Armstrong, please go ahead with your question.
Thank you, Vice Chair Peters and Chairwoman Wynn for this wonderful bill. And I just have a point that I need clarified. Director Whitley said we, when he spoke about the Medicare cost in the first 30 days after release. Could we get just some clarity on who was paying for that, how that is being financed?
For the record, Richard Whitley, if I may answer directly.
Absolutely, please go directly.
Again, for the record, Richard Whitley, the we being the state of Nevada, and maybe I moved too quickly through that, but the Department of Corrections currently provides 30 days worth of discharge meds to an inmate leaving, and that is paid for with general fund. If the inmate were enrolled in Medicaid, we would work with our managed care organizations to cover the costs and get the inmate with an appointment prior to the 30 days of medication running out.
Thank you, Vice Chair. If I can have a follow-up?
Yes, please.
Thank you so much, Director Whitley. So just so I'm understanding, if we can enroll those who are going to be released before they are released, not only do we have the opportunity to have a federal match for Medicaid, which would save money, but we would also have an opportunity to get them an appointment with the person who would provide that continuing care so that we can have a better opportunity for them to stay stable and carry on their care and stability. Am I understanding this correctly?
For the record, Richard Whitley, yes, you summarized it better than I originally told it. Yes, both of those are the two key pieces: savings of funding of general fund, and then the connection to an appointment prior to discharge, prior to the medication running out.
Thank you.
Thank you. We have the next question coming from Assemblywoman Black, please.
Thank you, Vice Chair. I'm curious. I don't see any fiscal notes on here. I understand maybe that there might not be one for the people that were on that are now going to be suspended instead of removed. But what about new people coming on? How does that not cost any extra money?
For the record, Richard Whitley, if I may again directly answer.
Yep, you may go directly to the Assembly people.
Not only are these individuals all eligible for Medicaid, so they're entitled to application and enrollment. We believe that actually, in the case of those that are leaving on medication, that they may actually be presenting a burden to our emergency rooms or having a crisis needing intervention because that continuity of care isn't currently as tight as it could be if they were enrolled in Medicaid. But their eligibility would already be covered, and they would mostly be newly eligibles, which is the higher federal match. So there would not be there. So you're correct. There is no fiscal note on this, not only for the operation of the enrollment, but for the actual delivery of services under Medicaid. There would not be an additional cost. The enrollments may go up, but they would go up. But people who are eligible for Medicaid can apply at any time, and we would not deny anyone who is eligible for Medicaid the enrollment.
Okay. I mean, I get what you're saying, but is there any way to know roughly how many new people this might be? Because if we don't automatically enroll them, they may never enroll. So you can't, I mean, they may get out and never enroll in Medicaid. So how do you, I can't believe that there's not an added cost. I understand that they would be eligible, but I can't believe there's not an added cost in some way to try to quantify that.
For the record, Richard Whitley, I would just add that, as you can see on the dashboard that I made reference to, we would continue that out to actually show the follow-up services that inmates received. We could match that even with the recidivism or the reduction we would hope in recidivism. But just like any population, we review their application for eligibility. If they get a job and they exceed the income, they would be terminated from Medicaid, just like any other population. But I think, to your point, probably what would be interesting to look at is how many people leaving corrections end up in the emergency room, perhaps with uncompensated care or with a more costly crisis because that continuity didn't continue. We've not looked at that, but we certainly could.
That would be useful information. Thank you.
Thank you, Director. For reference for the committee, the link that Director Whitley was talking about, that dashboard, is available on Nellis if you'd like to check it out. It's pretty great. Assemblywoman Gorlow, do you have a question as well?
Yes, thank you, Vice Chair Peters. I just had a quick question regarding success with local jails. How's that been going for you? Could you elaborate a little bit, please?
Sure. For the record, Richard Whitley, I can speak most comprehensively on Clark County Detention Center and the Washoe County Detention Center. We actually have eligibility workers who go in. We have a good working relationship with the captains at each of these facilities. The models are a little different in rural Nevada. It really is relationship based with sheriffs and whether or not they want us, in their facility. The solutions, in the jail are largely written applications. we continue to look at making it as easy as possible and certainly as less interruptive as possible. But I would note in Clark County Detention Center during COVID, we have prior to COVID, we were averaging a few hundred applications a month. With COVID and some of the restrictions on our staff being able to go in and assist with eligibility, those numbers had gone down. But we had the Captain Teal with the Clark County Detention Center reached out and said, we've got to get, this is so good for our community. They've directly seen a reduction in recidivism and asked us to get this back up, get our staff, with PPE and being able to go back in. And so I would aspire to actually have our State Department of Corrections have outcomes like our large detention centers. I think the enrollment there, our welfare and eligibility workers do a fantastic job with getting folks enrolled.
Thank you.
Thank you so much.
Thank you, Assemblywoman. I wanted to just ask if there is quantifiable data related to that detention center in Clark County that you were referencing, Director, that we could see that may help relieve some of Assemblywoman Black's questions as well on what kind of results we're getting from the lack of recidivism and the care provided through Medicaid offered to those inmates.
For the record, Richard Whitley, yes, we have Clark and Washoe detention data that we can provide going back to 2019.
Thank you. As it relates to data, I actually was wondering if you keep popping off as I'm trying to catch you, Director. But do you have the dollar amounts of what is currently being spent on those purchase of medications as inmates are leaving the system for those 30 days worth of medications that they're getting?
For the record, Richard Whitley, I don't. I believe we've worked on that. I don't know if in the Department of Corrections budget, if they carve out their pharmaceutical costs that way or not, but it definitely as we have this huge opportunity for improvement in the enrollment, I think it would be an important piece of data to capture, not only for that 30-day, did they get their appointment before the 30-day, but then that cost. I can follow up with the Department of Corrections and ask that question.
Thank you. That would be, I think, helpful in understanding the kind of win that this would be. And also, I'm sorry, I also have another clarification for you on the Medicaid match. Do you, what is the percentage of the Medicaid match right now? Or can you give us dollar for dollar on what the state puts in and how much is matched through the federal programs?
Richard Whitley, for the record, I believe primarily this population would be newly eligible, and so it would be the 90% of federal match.
So for every 10 cents, the state puts in 90 cents from the federal government would be matched to that?
For the record, Richard Whitley, yes.
Great. Thank you. Thank you for the clarifications. Are there any questions from the committee? I see Assemblyman Hafen.
Thank you, Vice Chair Peters. I did have just a really quick question that came up during the line of questioning here. And it's actually the amount of dollars that the state is currently spending on medication for inmates. And I may have a follow-up, Vice Chair Peters, if that's okay.
Director Whitley, is that something that you want to respond to?
For the record, Richard Whitley, I think I mentioned before that I don't have that from Department of Corrections. So currently it's in the Department of Corrections budget, the healthcare of the inmates, and that would include their discharge medications. But I'd be happy to reach out to them and get the information.
Thank you. And thank you, Vice Chair.
Thank you. Are there any other questions from the committee? I'm not seeing any. Excuse me. So I'm going to go ahead and move us into testimony. Can we go ahead? Do you have anybody on the Zoom in support testimony, Assemblywoman Nguyen?
I don't believe so. That hasn't presented or hasn't been, I don't see anyone. Director Whitley, is there anyone that was testifying in support?
For the record, Richard Whitley, no, I'm speaking for our department in support of the bill.
Thank you.
Thank you. Broadcast, can we go ahead and check the phone lines for support testimony?
I'm sorry, Chair. Vice Chair, this is Assembly Bill 343, correct?
I'm sorry, this is Assembly Bill 358.
358, I'm so sorry. Thank you. To testify in support of Assembly Bill 358, please press *9 now to take your place in the queue. The caller with the last three digits, 725, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Thank you, Chair Nguyen and Vice Chair Peters and committee members. This is Nick Shepak, Nickshepak, representing the ACLU of Nevada. Formerly incarcerated individuals suffer disproportionately from health-related problems and can pose health risks to their family members and the communities. Prisoners experience infectious diseases such as HIV, AIDS, hepatitis C, and tuberculosis at a rate of 5 times higher than those of the general public. And many suffer from a variety of mental illnesses, some very severe. Health problems can also hinder a formerly incarcerated person's ability to secure employment. Access to health care is an essential yet often ignored aspect of successful re-entry. Medicaid expansion under the ACA has offered an unprecedented opportunity for formerly incarcerated people to gain access to health care. There are many barriers for formerly incarcerated people that make it difficult to enroll upon release. For one, they are dealing with other urgent issues such as housing or employment and may not have the time or the bandwidth to seek health insurance post-release. The Henry J. Kaiser Family Foundation, using data from the annual Medicaid budget, found 38 states are working with prisons and 32 are working with jails to help facilitate Medicaid enrollment prior to an inmate's release date. Additionally, in 37 states, Medicaid benefits are suspended rather than terminated upon being incarcerated in prison. Half of states also report that they are working to enroll parolees in Medicaid. By ensuring that all eligible parties are enrolled in Medicare or Medicaid upon release from prison, we can reduce recidivism rates, reduce the community spread of communicable diseases, and provide one more tool for success for those being released from prison. We urge you to support this very important piece of legislation. Thank you.
Thank you, Broadcast. Before we go on to the next person, I just want to restate, because I forgot to before we open it up for support testimony, that testimony is limited to 2 minutes per caller. You are always welcome to send in written testimony up to 48 hours after the committee hearing, and we will be taking a testimony period of 20 minutes for support. Broadcast, if we could see if there's another caller in support.
First, would the caller with the last three digits, 080, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hi, Jim Hoffman, Hoffman, representing Nevada Attorneys for Criminal Justice. NACJ supports AB 358. Healthcare is an important part of preventing recidivism in formerly incarcerated people. In particular, a lot of theft and drug crime is driven by untreated mental health problems or drug abuse. By ensuring that people have access to mental health treatment and drug counseling immediately upon their release, we reduce the likelihood that they will reoffend. This is better for the people involved and better for the community as a whole. Therefore, NACJ supports AB 358. Thank you.
Thank you for the call. Do we have anyone else in support?
Yes. With the caller with the last three digits, 318, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Vice Chair Peters and members of the Assembly Committee. This is Kendra Birchie with the Washoe County Public Defender's Office, KENDRABERTSCHY. And I'm testifying today in support of AB 358 on behalf of the Public Defender's Office in Washoe County, as well as Clark County. We first want to thank the sponsor as well as our Chair Nguyen for bringing this important bill forward. This committee and the legislative body passed last session AB 236, which the whole purpose of that was to enhance our criminal justice system and provide individuals with services to ensure that they don't enter into the criminal justice system in the first place. This bill will expand on that and help ensure that those who are involved in the criminal justice system when they're leaving jail or prison have Medicaid so that they are able to successfully re-enter society and reduce recidivism. As of 2019, 43 other states have already implemented these suspension policies for some prisons, and over 42 states have done the same for jails. Currently, a cost in the Clark County Public Detention Center, $190 per day for healthy inmates to be housed there. In Washoe County, it's between $130, and I may be wrong on the low end, but up to $300 or $500 depending on the medication and needs of that individual. Unfortunately, because of the lack of housing, sometimes our clients are stuck in custody waiting for a bed space or waiting for other services because their Medicaid has been terminated. And that's time in custody that we're spending for, where if we had the ability to provide them with resources quicker, then they'd be able to reintegrate sooner to save us money in the long run, as well as reduce recidivism. So thank you again for this bill, and thank you for your time.
Thank you for the call. Is there another person in support testimony?
Yes. For the caller with the last three digits, 104, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chair and members of the committee. My name is Maria Teresa Lieberman Parraga. That is MARIA-TERESA-LIEBERMANN-PARRAGA. And I just wanted to say ditto to what everyone else has mentioned. Everyone pretty much covered the reasons why we support this bill. And we really want to thank Assemblywoman Nguyen for bringing this forward, especially at a time when, not just in prison, but especially when folks get released, healthcare access is more important than ever during a pandemic. So thank you again, Assemblywoman, for bringing this forward, and we ask for everyone's support. Thank you.
Thank you for the call. And just for the record, I'd just like to let the Secretary know that Assemblywoman Titus is here. Can we move on to the next caller in support?
With the caller with the last three digits, 261, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon and thank you. My name is Jillian Block. That's GILLIAN-BLOCK. And I am speaking in support of Assembly Bill 358 today on behalf of the Nevada Coalition of Legal Service Providers. The low-income Nevadans that the legal aid providers serve often depend on Medicaid for their health care services, and access to health care is a vital piece of the puzzle of supporting individuals who are re-entering the community following incarceration. AB 358 will ensure that people leaving the criminal justice system have the ability to quickly regain access to health care services ensuring quicker access to medication, mental health services, and other essential services that people need to get back on their feet and be stable following incarceration. Terminating Medicaid coverage for incarcerated individuals unnecessarily delays access to critical health care, while suspension, instead of termination, provides continuity of care to formerly incarcerated people at a time when these individuals are particularly vulnerable. AB 358 promotes both individual and community health, reduces the risk of mortality and recidivism, and helps people succeed. And for those reasons, we support AB 358. Thank you.
If you have recently joined the call, so sorry.
No, that's okay. Go ahead.
If you've recently joined the call and would like to testify in support of Assembly Bill 358, please press star 9 now to join the queue. Chair, we have no more callers in support at this time.
Thank you. Next, we will hear testimony in opposition of AB 358.
To testify in opposition of Assembly Bill 358, please press star 9 now to take your place in the queue. Chair, we do not appear to have any callers in opposition at this time.
Great. Is there anyone wishing to testify who is neutral on this bill?
To testify in neutral to Assembly Bill 358, please press star 9 now to take your place in the queue. We have no callers in neutral at this time.
All right. And with that, Chair Nguyen, do you have any closing remarks?
Sorry, excuse me, 1 second. I'm having some technical difficulties here. I don't know if Director Whitley has any closing remarks. I know that this has been something that he has been working a lot with local jails to get people covered. I do see this as a cost savings from our general fund, the idea that we are paying for medication for people that are eligible for this. Essentially, it sounds like a 1 to 9 federal match. Is crazy to me, especially during a time where we are trying to do more with less. And I think this puts us in line with 43 other states in preventing recidivism, or decreasing recidivism, I should say, saving our state money, and also continuing the continuity of care for people that are incarcerated that are trying to reintegrate successfully into our communities. Director Whitley, do you have anything you'd like to say in closing?
For the record, Richard Whitley, I don't think I could say it any better than you just did. So thank you.
And I don't know, Vice Chair, do we hear any testimony in neutral?
I did call for testimony in neutral, and there was no one on the line.
I think we may have some callers on the Zoom. I don't know if they wanted to present their testimony in neutral at this time. I don't know if they lit up or not.
I apologize if I missed anybody on Zoom who wanted to testify in either opposition or neutral. Not seeing anybody come up on the screen. So I don't think anybody else is coming with testimony right now.
That's okay. Thank you. I didn't tell you, so that's my bad. So I apologize for not being clear about potential people on the Zoom. But
No,
thank you. And again, I would ask everyone to support Assembly Bill 358.
With that, I will close the hearing on Assembly Bill 358 and transfer the chairmanship back to Chair Nguyen.
Thank you. And with that, we will get started with our next couple of bills that we have going on. I will open the hearing on Assembly Bill 343 at this time. Assemblywoman Thomas, this bill provides walking audits of urbanized areas, and I will let her further explain what that means and what her bill does. And so I will turn it over to you, Assemblywoman Thomas, when you are ready.
Thank you, Chair Nguyen. Excuse me. Again, thank you, Madam Chair and members of the committee. For the record, I am Assemblywoman Clara Thomas, representing Assembly District 17 in beautiful North Las Vegas. I am introducing Assembly Bill 343, which addresses the health and walkability of our communities. Assembly Bill 343 is aimed at improving accessibility and public health. We Americans have come to appreciate the link between urban planning and the health of our citizens. Being able to walk to stores and restaurants serves the dual purpose of improving our health and reducing greenhouse gas emissions. By making cities safe and accessible for children, older adults, and persons with disabilities, we improve the quality of life for all of us. Walking paths, bike lanes, safe crosswalks, and curb cuts give us a chance to get outside and move, or commute to work without a car. There are initiatives in states all over the United States that recognize this link between pedestrians and bike-friendly communities and the improved public health outcomes that follow. Nationally, the CDC and AARP, along with many land use and transportation planning organizations, have endorsed the use of walking audits to better understand a community's needs. Our own Regional Transportation Commission and Nevada's Department of Transportation participates in a similar program known as Complete Streets. But it is my hope that this bill will take these efforts to the next level in Nevada by assembling a diverse group of people to conduct walking audits and to include accessibility to healthy food options. Food deserts are a well-documented problem in many inner-city communities, and Las Vegas is no exception. The pandemic has made it painfully clear that a lack of access to healthy food to fight diabetes and other preventable diseases continue to be a national issue. I want to mention that while I do not have any amendments to present to you today, I am working with stakeholders on a possible amendment to the bill. I will make sure to share any possible amendments with you prior to a work session. One of the amendments I am exploring is whether there are other agencies better suited to conduct or organize the audits, such as the regional planning agencies or regional transportation commissions. Another aspect would be the incorporation of Geographic Information System, or GIS mapping, as a way to make the data from the audits more broadly available. With that background, let me briefly go over the key provisions of the bill. Section 1 lays out the requirements for the district health department to conduct walking audits of urbanized areas within their jurisdiction every 3 years. Nevada's Division of Public and Behavioral Health would be tasked with conducting the audits in urbanized areas not covered by the 2 district health departments in Clark and Washoe counties. The audits will be organized by census districts in urbanized areas to determine whether the physical environment contributes to the health of the community or detracts from it. Section 1 further provides that audit results will be submitted to the City Council, County Commission, and any planning commission or regional entity with jurisdiction over the area. In addition, the audit results would be posted on the health districts and divisions' internet websites. Subsection 2 of Section 1 lays out the makeup of the audits group and the goals of assessing land use, site design, and other factors contributing to public health, such as lighting, curb cuts, crosswalks, sidewalks, and benches. I have also included access to healthy food in the walking audits because too many inner city residents have limited grocery and restaurant options. It is hard to eat well and be healthy when you are regulated to shopping at convenience store or eating at a fast food restaurant. Lastly, the audits would include suggestions on ways to enhance all these factors and thereby improve public health in the audit area. In closing, I urge support of Assembly Bill 343 and the concept of walking audits to better understand our communities and their needs so we can work towards improving public health. Thank you, and I'm happy to answer any questions you may have.
Thank you. And do you have any other people that are presenting with you regarding your bill?
On this one, no additional presenters, but I do have others that are on the call just in case there are some technical questions that I may not be able to answer.
Perfect. I am looking around to see if I have any questions from our members, and it looks like I have one potentially from Assemblywoman Titus.
Thank you, Madam Chair, and thank you, Assemblywoman, for bringing AB 343 forward. This is a new concept for me, and so I was just wondering, so how many other states have this? I certainly live in a very rural area that you have a tough time walking in my rural area, and I understand that it addresses certain population sizes and the expansion if it does well. So I understand all of that, but so can you give me some statistics or where to turn, and maybe you could for the committee members on other cities that have this and the results on. I understand certainly the intent. I do believe in getting out in local communities. I do believe in being part of your community. And I do feel that as a doc who still makes house calls, nothing opens your eyes greater than actually going out into your community to see what the realities are for these folks. And so I really much appreciate having some direction where I can do my homework and look into this more.
For the record, Assemblywoman Claire Thomas, through Chair Nguyen, to Assemblywoman Titus.
Assemblywoman Thomas, please feel free to go directly to the member asking the question.
I appreciate that, ma'am. Thank you. Assemblywoman Titus, just about every major city in the United States actually have walkability audits. New York, Washington State, just to name two. But in our own state, here in Nevada, back in, I believe it was 2005, Assembly Bill 231 had a walkability for our public schools. So we actually have walkability audits when we were dealing with our children in public schools to see about transportation, whether 2 miles was adequate for them to walk to school. So this concept that wants to improve on the one that Assembly Bill 231, which would be for our general community, especially now in 2021. There's so many things that I've noticed just this past summer when we were going around the community to see if children were able to engage in the internet. There were places that were very dark. There were places that sidewalks were crumbling. There were places where we needed curb cuts. So this is something that, just by me walking around during a campaign, noticed. And we have to move to the 21st century, as far as having food accessibility to our citizens, that, if we can have our children walk 2 miles to school, surely we can have a grocery store within 2 miles to our communities.
Great. Thank you for that, and look forward to having for the more information, some data. Thank you.
Yes, ma'am, I will get that.
Thank you, Assemblywoman Thomas. I'm sure that you will. And if you could provide that to Mr. Ashton, he could get it out to the rest of the committee if you receive that documentation. Is there any other questions? I didn't receive any message. Oh, I see Assemblyman Ornlicker. Go ahead.
Thank you, Chair Wynn. And thank you, Assemblywoman Thomas, for bringing forth this bill. I think it's a great idea. I have a question about Section 2B. So you list several things to look for, and those are all important things to look for. You also say to include without limitation, so they can look for other things. And one thing that occurs to me that it might be worth including specifically is to look for commercial operations that might foul the air with toxic chemicals that are produced at the site. That we know those are more common in minority and lower income communities. Perhaps that's picked up somewhere else, but it's an important thing for us to know about when we get this information.
We will do that. Thank you, Assemblyman Ornlicker. I will, I've jotted that down, and we will look into that also.
I see a question here, I believe, from Assemblywoman Black. I think I saw her hand raised. Is that correct? Go ahead.
Yes, thank you, Madam Chair. I'm not on Skype for some reason. So I have a question. What is an urbanized area? Exactly.
Thank you for the question, Assemblywoman Black. An urbanized area generally would be what we would consider the urban community of I'm trying to get a good definition to you.
Not to cut you off, but that's kind of my concern. I don't know what it is. There really is no formal definition, so I'm a little...
Well, I can get a formal definition for you, but it's the same thing for a rural community. Is there a definition for that?
Well, I mean, I think if you're saying we're going to study an urbanized area, then we need to be able to identify what is an urbanized area. Like, is there a population threshold? Is there a density threshold? That's all I'm wondering about.
And you are absolutely correct. There is a population threshold, as the bill indicates. With Clark County, there's a population of 700,000 or more. And in less populated area would be less than 700,000, which would, so that's, okay.
And Assemblywoman Thomas and Assemblywoman Black, I think we have Ms. Carly O'Krent, our LCD legal nonpartisan staff. I think she might be able to describe what that means in statute. If I can turn that over to her to answer. Maybe she can. We'll see. Ms. O'Krent, can you answer that question?
I can, sure. Carly O'Krent for the record. So the provisions of this bill only apply in a county that's over 700,000 people. And so currently that's only Clark County. So an urbanized area would be in Clark County.
Thank you, I appreciate that. Do I have a follow-up, Madam Chair?
Go ahead, Assemblywoman Black.
So the purpose of this is to collect the data, and then the data is put on the health department's website and say that there isn't a store where you can buy healthy food. We've just simply identified that. We haven't actually taken any steps to change it. It's just that, hey, this area is lacking this or needs cut-ins in the sidewalk, but it's just collecting data. It's not really, just so that I'm understanding what the intent is.
Thank you, Assemblywoman Black. To answer that question, yes, the bill wants to clarify what those areas are lacking, and we want to present it to the county commissioners, as I stated in my address, and other entities, so that we can afford this change. But there's one thing that we have to remember too, that that urbanized areas are actually missing a lot of grant money from the federal government. When you go in and change the way an area is, and you can document it, then you can apply for the grants, and with those grants you can make changes. So when we identify that certain areas are missing healthy food options, that's a big thing. And the reason why we can afford change is to hopefully get these grocery stores that can give us healthy food options to build. I hope that answers your question.
It did. Thank you very much. I appreciate it.
Thank you. Next, if we can go to Assemblywoman Summers Armstrong.
Thank you, Chair Wynn, and thank you, Assemblywoman Thomas, for your wonderful presentation. This issue is very near and dear to my heart, as I do represent a community that is within the urbanized area of Las Vegas, Assembly District 6. And this information is very important, the gathering of this information for all the reasons that you stated, which is once a problem or a situation is identified, then we have quantifiable data that we can use for the basis of grants and to provide and to try and find funding to resolve some of these issues. My only concern would be whether or not you have had an opportunity to meet with any of my question is, have you had an opportunity to meet with anyone from our local either Washoe or Southern Nevada Regional Transportation Commissions to see what they've gathered and how they gather, and whether or not there is an opportunity for collaboration, and who would be the lead for this bill would be my question. Thank you.
Thank you so much, Assemblywoman Summers Armstrong, for that question. That is an excellent question, and we have been in contact with the Transportation Commission. We this week will be sitting down with all the stakeholders to clarify the verbiage or language in the bill, to get all concerned entities together so that we can get this information. Because right now, some of the things that Clark County and Washoe County representatives, Joanne Jacobs and Joelle, excuse me, I don't have Joelle's last name, but I can get that from Washoe. Their concern was putting the weight on the health district, and I agreed that since we already have a way of assessing the audits through the Transportation Commission or RTC, that perhaps we can get together with them, and then the cost would not be burdensome on the health district, because this is something that they already do, and that we can just quantify what Assembly Bill 343 is looking to do, because they already have a way of auditing certain communities. I hope that answers the question.
Thank you. It sounds like it does. I'm going to go next. I have two more people in the queue. I will go next to Assemblywoman Gorlow.
Thank you, Chair Wynn, and thank you so much for this presentation. I just had a quick question regarding Section 1, subsection 1, where it discusses the 3 years that the audit needs to take place. How was the 3-year mark determined versus like 2 or 4?
Well, looking at previous, like I said, Assembly Bill 231, we do, got that information from them. But like I said, going back to our stakeholders meeting that we will be having, we will decide whether or not it's 3 or 5. And that would be in conjunction with the Transportation Commission and or RTC. When they walk to get their information, we want to make sure that we're not putting due pressure on them to get another, we want it all to be concisely done together. So I will be addressing that, and I will get that answer for you.
Great. Thank you so much. And could I have a quick follow-up, Chair?
Go ahead.
Thank you. And I apologize if I missed this. I had to step out for a moment. And I might not be clear in my own thought process, but I believe there are some zones that the federal government has already established, like level 3 zones, which are economically disadvantaged zones. And if you get, I think there are SBA loans in those areas, you can get some forgiveness. So this would really help that process so that they would know what they could build in those areas and what the area actually needs. So am I kind of putting those puzzle pieces together correctly?
Well, I haven't discussed zoning or zones, and I will bring that question up with the stakeholders this week.
Thank you. And again, I might not be putting those puzzle pieces together. I just remember some work that I did in my other job, and we were getting some loan possibilities, and they were talking a little bit about those economically disadvantaged areas. And so I'm thinking that this would work wonderful by determining what's needed in those areas and then encouraging investors to come in and build in those areas so that they can get some benefits for it as well through the federal government. So again, I might not be putting my puzzle pieces together too, but thank you.
Assembly Thomas, for the record, thank you so much. And I will include that in our conversation. It sounds like a good one. Thank you.
And I'm going to go to our last question before we go to testimony and support, opposition, and neutral, to Assemblyman Hafen.
Thank you, Madam Chair. My question just kind of came up during the conversation amongst some of these other questions that have come up, because I know we have I just had it up, the Nevada New Market Job Act, which allows certain business entities to receive a credit in certain communities if they do these investments that have kind of been talked about today. But the other question that I had to do with if you've actually talked to like the Clark County and their planning department to see if they're currently working on something similar. I do know that in Nye County, we did look at this, not as extensively as this bill proposes, but some of our recommendations came out to go into our master plan to expand for the bike lanes and things of that nature. So I just didn't know if there was any coordination with Clark County. They may be on the phone today to answer that, but I'm just kind of curious. Thank you.
And Assemblywoman Thomas, if I might just step in, I do see at least Clark County on the line. So Ms. Jacobs, if you can answer maybe Assemblyman Hafen's question, if Assemblywoman Thomas is not able to, I think that would be helpful.
I'd appreciate it, Ms. Jacobs. Thank you.
And with that, I will start testimony in support, opposition, and neutral. Again, I will remind our callers to please clearly state and spell your name before you speak, and please limit your testimony to 2 minutes. We do have another one of Assemblywoman Thomas's bills that I want to make sure that we have plenty of time to get to as well. At this time, we will begin testimony in support of Assembly Bill. Oh, I'm getting my numbers all mixed up. Assembly Bill 343.
To testify in support of Assembly Bill
Ready.
343, please press star 9 now to take your place in the queue. With the caller with the last 3 digits, 860, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hello, Good afternoon, Chair and members of the, sorry, I forgot to say my name. Good afternoon, Chair and members of the committee. For the record, my name is Jose Silva. That's Josesilva. And I am the Environmental Justice Organizer with the Progressive Leadership Alliance of Nevada, here in support of Assembly Bill 343. For years, constituents in Clark County have been raising awareness on issues that add significant pressure to communities of lower incomes. Not everyone who lives in the county is the sole owner of a vehicle. Many times a vehicle is shared between household members, and not all folks can get where they need to when they need to. I live about a mile away from a supermarket. It's a 4-minute drive, but if I was to walk there, it's a 30-minute walk. And walking back is also an additional 30 minutes. One side of the street has a paved sidewalk, and the other side does not have a paved sidewalk. And this street in general is very dark during the evening. Creating a process to help increase feasibility of pedestrian travel would be an important step in raising quality of life for non-vehicle owning constituents. Although this may sound detached from the feasibility of being a pedestrian, the importance of reducing vehicle contamination from our communities and neighborhoods plays a crucial role in maintaining the health of Nevadans. In addition, the American Heart Association in 2019 ozone report ranked Las Vegas as the 13th most ozone contaminated city in the US. Contamination can lead to Nevadans becoming ill. It increases medical costs, and in worst case scenarios, it takes lives away. I urge your support of this legislation to address the public health impacts of our neighborhood environments. Thank you, Chair and members of the committee, for the time.
Thank you for your testimony. We can go to our next caller in support.
The caller with the last 3 digits, 155. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Thank you, Madam Chair and members of the committee. For the record, my name is Christy Cabrera, CHRISTI and I'm the Policy and Advocacy Director for the Nevada Conservation League. First, I would like to echo the comments of Plan. Nevada is ranked the 11th most dangerous state in the nation for pedestrians, and we must do more to make sure that our streets are safe for everyone. We believe this bill will help our state better understand and address walkable neighborhoods and move towards creating safe environments for pedestrians, bicyclists, motorists, and transit riders. Walkable neighborhoods increase physical activities and promote healthier communities and can make our communities more safe, accessible, and enjoyable for everyone. Increasing walkability can also encourage people to leave their car behind, thus reducing greenhouse gas emissions and pollution. We'd like to thank Assemblywoman Thomas for bringing this bill forward, and we urge the committee's support. Thank you.
Thank you. We can go to our next caller in support.
Chair, there are no more callers in support at this time.
Do we have any callers in opposition at this time? If we do, can we go ahead and start with those?
To testify in opposition of Assembly Bill 343, please press *9 now to take your place in the queue. With the caller with the last 3 digits, 672, please slowly state and spell your name for the record. You have 2 minutes and may begin. Caller with the last 3 digits, 672, please press *6 to unmute.
Good afternoon, Chair and Committee. For the record, my name is Joelle Gutman-Dodson, and I'm representing the Washoe County Health District this afternoon. I wanted to thank the bill sponsor before I even start for having an in-depth conversation with me, and I look forward to further conversations. And while we are certainly in support of the concepts and the work in the areas that this Assemblywoman Thomas has addressed regarding nutrition deserts, environmental justice, air quality, and walkability to resources, unfortunately, as written, we're in opposition to the bill today because it's essentially an unfunded mandate for the health districts that we just can't afford to do right now. I have submitted a fiscal note. I don't see it on the list, but I hope that you guys do. We feel like the health districts right now, well, health districts in general might not be the appropriate placement for this bill and would require a professional skill set and a technology database or system that we just don't have right now. And it would require hiring and purchasing of that kind of equipment. I do think there are several things happening in each of our communities, north and south, that may meet some of the Assemblywoman's needs for this bill. And I look forward to a conversation with possibly the RTCs of Northern and Southern Nevada, as well as the Truckee Meadows Regional Planning Agency and the Southern Nevada Regional Planning Agency. So I think we can get to a solution. And I want to thank the bill sponsor again and look forward to further conversations. Thank you.
Thank you. And if we can go ahead to our next caller in opposition.
The caller with the last three digits, 653. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon. This is Dora Martinez. I apologize. I was calling in support, but I had so much trouble with my phone. May I proceed, or do you want me to call back?
You know what? I know that everyone is having difficulties, so I am flexible in this nature. So go ahead and testify in support. Madam Secretary, if we could just reclassify. I'd ask you to state your name, and again, please limit your testimony to 2 minutes.
Yes, ma'am. Thank you so much. Good afternoon, Chair and members of the committee. My name is Dora, D-O-R-A, Martinez, M-A-R-T-I-N-E-Z, and I'm calling in support of SB 183. I am totally blind and I have a service dog, and I utilized our sidewalk. I live in North Reno, District 27, Assemblywoman Benitez Thompson, awesome lady. We have a lot of sidewalk, and I utilize the sidewalk. Pretty soon my kids will be going to military, and I won't have a driver. And I do not want to always depend on buses. Sometimes they're late. Sometimes they're canceled due to mechanic and lack of drivers. So a usable and accessible sidewalk is awesome. Me and my service dog and my husband, we walk a lot. And if there was a sidewalk all the way to Carson, I'll be there too. So thank you so much and have a great afternoon.
Thank you. If we could go back to our testimony in opposition of the bill.
If you have recently joined the call and would like to testify in opposition of Assembly Bill 343, please press star 9 now to take your place in the queue. Chair, there are no more callers in opposition at this time.
Thank you. And if we can go now to callers in neutral of the bill, that would be great.
Testify in neutral to Assembly Bill 343, please press star 9 now to take your place in the queue. With the caller with the last three digits, 200, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Madam Chair, members of the committee, Bradley Mayer of Argento Partners, representing Southern Nevada Health District today. Just wanted to weigh in. Certainly the intent of this bill is good for public health, and I would just share that we are working with the Assemblywoman. We've been in contact with her, and we're hoping to working on this bill together. But we also at the Health District are engaged in some of these walking audits, specifically, like, for example, one we're doing with the City of Henderson in conjunction with their Parks and Recreation Department that also focuses on low-income census tracts, and then working also with the City of Las Vegas and UNLV to help develop a decision support tool for city public works that it's a tool that planning, public works, and transportation professionals will use to integrate health, safety, and equity-related considerations into land use. Really to support, safe, walkable, bikeable, and connected communities. So we are doing some of this work. We're still evaluating the fiscal and operational impact of this. This bill came out last week, and then, of course, being heard today. And so we're just looking forward to working with the Assemblywoman as she works on some amendments for this bill ahead of work session. And we thank you for your time.
Thank you. Do we have any other callers in neutral?
Yes, Chair. Would the caller with the last three digits, 739, please slowly state and spell your name for the record? You have 2 minutes and may begin.
Good afternoon, Madam Chair. This is Joanna Jacob, Joanna Jacob, on behalf of Clark County. I originally was going to be testifying on another bill in this committee, but I am calling, I guess, in to see if I can try and answer the question in part raised by Assemblyman Hafen. I did, just as a note, in neutral on this bill because I tried to work with Assemblywoman Thomas last week to try and connect her to appropriate people at the RTC in Southern Nevada. Because they are engaged in transportation planning, and that includes walkability for the regions that they serve, including Clark County. They are really this is the bread and butter of what they do. So we're trying to help to engage in this process. As Assemblyman Hafen noted, our comprehensive planning department does assess this, and especially a complete street policy. As we are rewriting our codes right now, we are engaged in looking at this in a comprehensive way. We have added bike lanes and sidewalks where feasible. Every time that we update a street in Clark County where it is feasible, we always address ADA compliance. And so this has been something that has been discussed at our board. So Assemblyman Hafen, yes, we are engaged in doing this work as well in a comprehensive planning way that we do in unincorporated Clark County. We will continue to work with the Assemblywoman on this bill and take part in the stakeholder group, certainly, Madam Chair, and assist where we can. Thank you.
Thank you. Do we have any other callers in neutral?
Madam Chair, there are no more callers in neutral at this time.
Okay. At this time, I will turn this back over to Assemblywoman Thomas for any closing remarks, unless you would like to waive them at this time.
Thank you, Madam Chair. I do appreciate the closing remark. Like I stated earlier, we are working to solidify this bill to make it amenable to just about every agency that has a hand in affording the walkability for our residents. We know that this is something that's probably new to the state of Nevada, because when I first moved here in '82, they didn't have sidewalks. So we are gradually moving to the 21st century, and I look forward to meeting with the stakeholders this week. Thank you so much.
Thank you for that. And with that, I will close the hearing on Assembly Bill 343. And at this time, I will now open the hearing on Assembly Bill 344, which authorizes the establishment of a program to facilitate transition of the care of older persons and vulnerable persons. And again, I will turn it back over to you, Assemblywoman Thomas, to begin when you are ready. You are muted, Assemblywoman Thomas. We can't hear you.
Oh, you guys missed a beautiful introduction. Good afternoon, Chair Wynn and members of the committee. For the record, I am Assemblywoman Claire Thomas, representing Assembly District 17 in beautiful North Las Vegas. Thank you for the opportunity to present Assembly Bill 344 before you today. This bill aims to improve care coordination and continuity of care for elderly Nevadans and individuals with disabilities following discharge from the hospital. Before I begin, I would just like to draw your attention to the amendment I submitted, which should be on Nellis, and which I will discuss in a minute. Being in the hospital is hard, and when a person is discharged, there are often aftercare instructions to follow, new medications to take, and follow-up appointments to attend. The post-discharge time can be hard for anyone, but it is especially hard on elderly individuals and those with disabilities, and particularly for those who do not have a support system or whose caregivers are not familiar with navigating the healthcare system. I recently experienced this firsthand when my mother was in the hospital. You see, after her stroke, no one realized that this was the onset of dementia. Mom became very confused and frustrated whenever seeing her doctors and could not remember what she was advised to do. My brother, as her caregiver, would ask to go into the examination room so that he was able to get the information and assist Mom with her meds and other doctor's orders. The goal of this bill is to authorize the Department of Health and Human Services to create a program to improve care coordination and continuity of care for vulnerable Nevadans after they have discharged from the hospital. Specifically, subsection 1 of Section 1 of Assembly Bill 344 authorizes the Division of Aging and Disability Services within DHS to establish a program through regulations to help older Nevadans and Nevadans with disabilities with the transition from the hospital to their home. Currently, the bill refers to older persons and vulnerable persons. However, in working with ADSD on this bill, I am proposing an amendment to replace the term vulnerable person with a disability, which is language currently used in Nevada revised statutes. This amendment does not change the intent of the bill, but simply ensures consistency in the use of the existing terms. If ADSD creates this type of program, it must provide for cooperation between hospital staff who are responsible for discharging these individuals, as well as the individuals and their caregivers. It must also facilitate the coordination of health care and social services to support these individuals and their caregivers. Subsection 2 of Section 1 of the bill allows ADSD to limit the program to certain groups of older individuals or people with disabilities based on funding. It authorizes the division to accept gifts, grants, and donations in order to establish and operate the program, and to use other available options to fund it, including billing third-party payers, such as health insurance for services provided by the program. And that brings me to another amendment that I'm proposing in Section 1, subsection 2C, which follows: use other options available to fund the program, including, without limitations, billing third parties for the services provided by the program for current plan members. That is the additional verbiage, for current plan members. Subsection 3 of Section 1 of the bill defines older person to mean an individual who is 60 years of age or older, and it defines the term third party to include various health insurers, and it defines vulnerable person. However, as I mentioned, the proposed amendment would replace the definition of vulnerable person with the term person with a disability. Finally, this bill should not have a fiscal impact to the state, as it authorizes ADSD to establish a program to the extent money is available for this purpose. At this point, with your permission, Madam Chair, I would like to turn my time over to Jeffrey Klein, President and CEO of Nevada Senior Services, Inc. Mr. Klein's organization currently has a program that is doing this type of work, which has been extremely effective. We submitted 2 documents that I believe he will discuss so that everyone has a better understanding of the type of program we envision through this bill. After his presentation, we would be happy to answer any questions, and I believe Cheyenne Pascal, Social Services Chief, ADSD, DHS S is available to answer any technical questions from the division's side.
That would be fine. And I would also remind members or let them know that the amendments that you've been speaking about in your presentation should be on NOAA. I believe they were uploaded this morning. If you don't have them, please let committee staff know and they can make sure they send you an email with those. And go ahead with your the remainder of your presentation. I just remind your presenters to please clearly state their names when they prior to presenting.
Thank you, Chair. Mr. Klein?
For the record, I'm Jeffrey Klein. I'm the President and CEO of Nevada Senior Services. I'm a member of Nevada's Commission on Aging and chair its legislative subcommittee. And my thanks to Assemblywoman Thomas for bringing forth AB 344, and my thanks to Chair Wynn and Vice Chair Peters for the invitation to be here today. Briefly, the PowerPoint you have is actually going to have more material in it than I intend to cover, but I thought it would be useful reference information for you. So if I have included some additional information. Briefly, Nevada Senior Services operates 2 adult day healthcare centers. We provide in-home respite, home modifications. We do clinical geriatric assessment. We have a wellness set of initiatives, and we are the Nevada Care Connection Resource Center for Lincoln, Nye, Esmeralda, and the majority of Clark counties. And as you're about to hear, we are on the very much ground floor of the development of what we call hospital to home, which is a care transitions programs for really some of the most difficult populations that we have. As you know, Nevada is among the fastest growing senior populations, if not total populations in the country. And with that comes the issue of dementia. And Nevada has seen an astronomical increase in deaths from dementia. Alzheimer's deaths have increased 261% since 2000. It's the 6th leading cause of death in Nevada. And as you'll see, it's a major driver of hospital admissions and readmissions. One thing I might note parenthetically is that we're faced nationally, but very much in Nevada, with the fact that while lifespan is much longer, health span is becoming more and more problematic as we live longer. So we have people with multiple chronic conditions, which ultimately lead them to be greater consumers of healthcare and more likely to be admitted to the hospital. Persons with dementia and frail elderly typically will have also care partners, family members who are responsible for assisting them in maintaining themselves in the community. And those folks can be very stressed when family members have chronic diseases. We know that dementia in particular increases the burden on acute care systems. Any hospital executive will tell you that, and I was one for most of my career. It creates excessive resource consumption, higher complication rates, both in the hospital and after the hospital, and generally results in poorer outcomes. They're more likely to be hospitalized than the general population over 65. About 25% of all hospital patients 65 over have a dementia. And there are all sorts of studies about the issue of dementia in the record. And that is very few of the folks who are hospitalized, even who have a dementia, have it exist openly in their hospital record. And quote my wife's grandmother, don't let them know how old you are, and don't let them know if you're having problems thinking. There's a fear factor in seniors in particular, but also other vulnerable populations in having the hospital staffs even be aware that they have this kind of a fragile situation. Hospitalization rates for persons with dementia are more than twice what they are for the cognitively healthy. A third of hospitalized persons with Alzheimer's disease average 1.5 to 2 hospital stays a year. A couple of things worth noting that people with dementia comprise 40% of the total hospital readmissions, 30-day readmissions. Hospitals are faced with a huge problem of people who are living alone at home with dementia, representing an unsafe discharge, which clogs hospital beds because the hospitals have difficulty even discharging them. And Clark County, for instance, has one of the highest readmission rates, Nevada overall, but Clark County in particular, has one of the highest readmission rates in the country, with over 35% of Medicare patients being readmitted to the hospital. They're more likely to not regain their health. So that you have people whose discharge issues associated with their ability to function in their home gets negatively impacted in the hospital, which makes them a more complicated discharge and more dangerous to discharge to the home without successful supports. And they're more likely to get discharged to a nursing home, which we know is not the location of choice, as we found out during the COVID-19 epidemic. And we'll talk about that briefly in a minute. They're also 3 to 7 times more likely to be living in a nursing home 3 months after discharge. So, which really represents both a human cost and an economic cost to the state of Nevada. Our hospital home program started originally with a pilot program that was funded by the Nevada Aging and Disability Services Division as a subset of an federal administration community living program grant. We piloted what we thought was an innovative approach to dealing with this population. We brought 25 dyads or 50 people through the program to test it. And it worked so well that we were invited by the Federal Administration for Community Living to apply for a much larger 3-year grant, which just ended. And we'll talk about the outcome of that a minute ago. So traditional discharges, this population, as we originally envisioned it because of the grant, was focused heavily on the dementia population, persons with intellectual developmental disabilities who are at much higher risk for dementia, the frail elderly who are hospitalized for any medical condition, live-alones, and most recently COVID-19 related admissions and discharges. And we have right now a caseload of over 150 of those persons right now in Clark County who have either been directly or indirectly impacted by COVID-19 and a discharge from hospital to home. We use a model that was originally developed by Rush University Medical Center in Chicago, adapted it for our environment, and developed a collaboration initially with the Valley Health System, their 7 hospitals, and ultimately now has spread to most of the hospitals in Southern Nevada. The collaboration is really important. And one of the things it brings in addition to the hospital collaboration is for the clients a post-discharge care transitions wraparound for all the services they need. The approach is both these days in person and or telephonic because of the whole COVID-19 limitations. The first contact is within 1 to 2 days post-discharge if we don't catch them in the hospital first. And the duration of the core program is 30 days. It focuses on the values and the desires of the individual, and that's really critical. We talk about person-centered, but it's more than that. People crave autonomy. And those of us in the healthcare field, and even as family members, crave safety. And so we're very often inclined to sacrifice the wishes of the person who's trying to be discharged from the hospital who is complex in favor of what we think is going to keep them safe. And that push and pull is really important. In hospital to home, we start with the desires of the individual. And then we look to see how can we do that in a safe way. And it includes both internal and external referrals for ongoing supports. So we start out with this 30-day program. We develop personalized care plans. We deal with behavioral and psychological symptoms. And the whole goal is to support these folks to not only make the transition, but to be able to engage going forward in access to supports, which keeps them safe in the community. We've added a fairly innovative feature to the program called Respite Coaching. And right now we're kind of evaluating what the best personnel to ultimately long-term be delivering that service. We're starting to think community health workers, which has a special place in Nevada. But the idea of the respite coaches is to decrease post-hospitalization stress and caregiver burden, because we know caregiver burden is likely to either cause readmission or worse, long-term care placement. It provides a short-term intensive respite, but also allows us to provide training to the family caregiver on handle what's going on in their home and to make connections for long-term supports. And these respite coaches, which are teamed, are an intrinsic part of this whole idea of care transitions, which is unique to Nevada and unique to our program. So we're very excited about it. The service delivery also ties into referrals to community, public, and private resources. We have social workers, licensed social workers on the team who provide case management, long-term services and supports, which is a natural for our Aging and Disability Resource Center initiative, basic need programs, and caregiver education and support, which is really important. How do we educate family caregivers to be better navigators of the healthcare system and the social services system, both coming and going? And we've created a series of workshops for the family caregivers and for healthcare professionals. So by way of outcome, this is last year's numbers, as you can see. And out of 363 clients, participants who came through the program, the admissions for the same diagnostic related group was 0. Let me just say that screamingly one more time. Not one person was readmitted to the hospital. Not one. And we're excited about that because not only the human savings, but the financial savings of keeping people successfully in their homes and having them not bounce in and out of the hospital. There were 6 out of 363 who were ultimately admitted for a different DRG. So somebody had a stroke, and then 3 months later, they fell and broke their hip. That was a different admission. A couple of interesting things that came out of some of our studies that I think will help you understand how the pragmatics of the program and how important they are is if you take a look at what we call first-tier discharge challenges, insufficient support at home is 66% of the cases. And you can see the other issues that bring. So we know that this is a critical factor. And referrals for support, caregiver support, 76% of the people discharged required caregiver support, 75% respite care, which is a topic for another day with the legislature. And then home modifications, 36%. These are just critical for wrapping this into this whole idea of a successful discharge. So basically, what's happened with this program now, it's become more ubiquitous. We started with dementia and then moved on to broader cognitive impairments, then to COVID, and now the broad arena of people who are complex, have family caregivers, or have an array of problems which make them difficult to discharge. We know that it clears beds in the hospitals faster. We know it eliminates unsafe discharges to homes. We know it predicts outcomes. We know it keeps people out of long-term care and therefore reduces their risk for things like COVID or pneumonias or even the flu. So it's been a highly successful program. We're very supportive of the state of Nevada having a broad-based program to assist hospitals to have this resource available, and most importantly, to assist our seniors and those persons who are at highest risk to be able to get back to home and stay there without readmissions and without costly utilization of services and without the need for long-term care placement. So I'm happy to answer any questions. And once again, my great thanks to Assemblywoman Thomas for taking on this very tough issue and one that has a big impact on a very much aging and fragile population. Thank you.
Thank you, Mr. Klein, and Assemblywoman Nguyen, Chair Nguyen. We're open to answer questions. Thank you.
No problem. Thank you for that presentation. I know that you have some other callers that might be able to answer some questions as well. I have Assemblywoman Titus. Go ahead with your question when you're ready.
Thank you, Madam Chair, and thank you, Assemblywoman Thomas, for bringing this bill forward, and Mr. Klein for being part of the testimony or presentation of this bill. I have a couple questions, actually. First, as a provider, having been administrator and director of a long-term care unit and worked in the ER literally thousands of hours, discharging patients, et cetera, there's already a mandatory requirement that discharges, we have a safe discharge. And so we have discharge planners and we have throughout this legislative process, created patient advocates, communications, and so that we have to have that warm handoff, that safe discharge. And I'm wondering, what does this bill change any of that? And if so, my first question. Second question is, we're limiting this now to just persons with disabilities. And I'm wondering now, will we not have to have that safe discharge with all the other patients that I discharge? And then finally, Mr. Klein, I'd like some more details after you answer those questions on some of the studies that you did with your group, because it sounds like you're already doing this. And what will this law change that you're not already doing? So I know that's a lot, and I'm going to throw that out there.
Thank you. To Dr. Titus and Chair Wynn. Let me just kind of
go. Mr. Klein, make sure to remember to state your name before speaking, and you can go directly to the member.
Thank you. Jeffrey Klein for the record, to Dr. Titus. And I have to tell you, you raised several really important questions. One of the issues about this kind of hospital home program is it really focuses on the most complex cases. And I think that's something that traditional discharge planning really just doesn't get to. And the example I always give is, you have a 45-year-old gallbladder surgery, and the discharge planner comes through the door and says, when can your person pick you up? You're going home today, and make sure you take your medications and get back to your doctor. And if the hospital's got a good care transitions initiative, then they follow up to make sure you filled your prescription, you booked your doctor. But to a family caregiver who is so totally fried that they're basically immobile because they've been taking care of a loved one for a long period of time who's now ended up in the hospital, they just need way more help and supports. They have issues that go way beyond, and I'm not going to drag you through the long case study we submitted, but just to give you an example, a couple of highlights, this is a SWAT team at work. Very often people come in and they don't have a working refrigerator when they're going home, and no food in there and no way to fill their medications. And what hospital home really tries to do is decompress that family caregiver and get life back under control and take away, in the first couple of days in particular, a lot of those really pressing issues that have so immobilized those family caregivers, so that they can kind of clear the air, deal with them, and then have a support system. And so that is fairly unique. And it's not necessarily a program that everyone needs, but we certainly think our highly complex, more fragile family caregiving situations, whether they're in the elderly or in adults with disability population, find it really very, very valuable. The other element that I would touch is that not only is it humane, but it is financially beneficial.
Mr. Klein, you're already doing this, just to be clear. You already have this program, and do we need legislation to enact a program that you are already doing?
Well, it's not available to everybody. It was done originally through a federal grant, which is now over. And so now we have it available on a limited basis through some very minor funding that we have available, either through the Division of Aging, the Older Americans Act money, or COVID money, which will expire, by the way, on September 30th of this year, or to a limited number of insurers that are willing to pay for portions of the service. It's not yet covered by Medicare as we know it, and it's not yet covered by Medicaid as we know it. So it only exists to the extent that we're able to provide funding and do it for free for people.
But nowhere in this legislation does it mandate that Medicaid or Medicare pays for it, but it enables you to accept grants to expand the program?
Well, this would be the Aging and Disability Services Division would be able to accept those grants and then contract with us or others to help deliver the program. But more importantly, I hope it sets a platform for Medicaid and to cover the service where it'll be cost beneficial. And secondly, it encourages the hospitals to encourage their managed care partners to participate in it. And right now we have several managed care organizations that are looking at it, but certainly encouragement from the state of Nevada would help.
Follow-up question, Madam Chair.
Go ahead.
So that brings me back to the statement you did during your testimony and the study that you used that your organization did regarding readmissions. And you testified that I believe 100, I'm not sure what your N number was, maybe 150, I'm not sure on my notes, but you said that no one was readmitted for the original diagnosis.
Correct.
What was the length of time that you actually, was it within 30 days no one was readmitted for the original diagnosis? And was the diagnosis limited to just a mental dementia, or what was that diagnosis that no one was readmitted for, and within what period of time?
Jeffrey Klein for the record, and to Dr. Titus's question. The study had 363 people in it over a 3-year period of time. Really 2.5 years, because the first 6 months was a planning cycle. And it included a wide range of diagnoses, from surgeries to heart failure, chronic obstructive pulmonary disease, late effects of diabetes, and so on. So it had a pretty wide range. The initial work was limited to persons with a dementia, not necessarily diagnosed dementia, but a perceived dementia, if no diagnosis was available, and later became broadly available to complex families with COVID. So some of those numbers in there are actually people who had a COVID diagnosis or were admitted to the hospital with a suspected COVID diagnosis.
Mr. Klein, if I could just interrupt, I know that we also have Ms. Pasquale from the Chief of the Aging and Disability Services Division. She might be able to also answer this question. I don't know if you want to unmute yourself and be able to address that as well, on why this legislation is needed if we're already doing it in some aspects.
Sure. Cheyenne Pasquale for the record. Well, I think to Mr. Klein's point, they piloted this program and they were able to develop a model that can really be replicated to scale. And this legislation offers ADSD the opportunity to build the capacity across the state and give this type of program, make it available to a broader audience, or a broader population, sorry.
Thank you. Assemblywoman Titus, does that answer your question as well?
It helps, but I just see that there's nothing that prohibits it from happening already, since we're already doing it in some form. And I guess the answer to my question is that it enables them to potentially expand the program and look at future payment resources, is what I'm hearing. But thank you for all the questions, Madam Chair.
No problem. And I will kind of follow up with that, just see if we can get some clarity on the record. Ms. Pasquale, I'm sorry, I said your name wrong the first time. Would this enable us to apply for different grants and funding, and without this, would we not be able to?
Thank you. It would not prevent us from applying for grants if we did not have this legislation. What it does do is it gives us a little more backing, I guess I would say, when applying for grants, to say that this is a priority for the state of Nevada. It's a legislatively approved program. And so I think that can help to make us more competitive in our grant writing.
So am I correct in asking if this would, just having the legislative, I guess, backing or support would enhance applications of people that wanted to get into a grant program? Is that correct?
This is Cheyenne for the record. Yes, it can help to support that. It also provides an opportunity, this legislation specifically also provides an opportunity for the division to explore other funding mechanisms.
Thank you. And I'm going to look around here. I haven't received any messages. Do we have any other questions from committee members at this time before I go to testimony and support, opposition, and neutral? Seeing none, broadcast services, can we please begin on testimony and support of this bill? And I would remind callers to please clearly state and spell your name for the record and limit your testimony to 2 minutes. At this time, we will begin testimony in support of Assembly Bill 344.
To testify in support of Assembly Bill 344, please press star 9 now to take your place in the queue. The caller with the last 3 digits, 261, please slowly state and spell your name for the record. You have 2 minutes and may begin. Caller with the last 3 digits, 261, please press star 6 to unmute.
Good afternoon. Thank you, Chair, members of the committee. My name is Jillian Block, Gillian Block, and I am speaking in support of Assembly Bill 344 today on behalf of the Nevada Coalition of Legal Service Providers. The Legal Aid Center of Southern Nevada and Washoe Legal Services serve older persons and vulnerable persons, providing representation to seniors and adults with disabilities who are facing or who are under guardianship to ensure the adults' legal rights are protected. We support increasing opportunities for collaboration between hospital staff and caregivers to coordinate healthcare and social services for older persons and persons with a disability, such as our guardianship clients. Care coordination programs can help to improve continuity of care, improve outcomes, and provide a smooth transition home for people who are most vulnerable and in need of ongoing support. Thank you very much.
Thank you for your testimony and support. We can go to our next caller.
Chair, we have no more callers in support at this time.
Do we have any callers in opposition at this time?
Testify in opposition of Assembly Bill 344, please press star 9 now to take your place in the queue. Chair, we have no callers in opposition at this time.
And we may have some callers in neutral on the Zoom call. If you are, I'd ask you to unmute and turn on your video at this time. Seeing none, I will go ahead and go to neutral testimony on the line if we have any.
To testify in neutral of Assembly Bill 344, please press star 9 now to take your place in the queue. Chair, we have no callers in neutral at this time.
Okay, at this time, I will turn it back over to Assemblywoman Thomas for any closing remarks.
Thank you, Chair Wen and committee, and I'm hoping that you will support Assembly Bill 344. It is necessary. It is a good program for the most elderly person in our community and those with disabilities. And I'm hoping that the committee will support Assembly Bill 344. Thank you.
Thank you for that presentation. At this time, I will close the testimony on Assembly Bill 344. And at this time, we will go to public comment. Broadcast services, can we see if anyone's on the line for public comment? I would remind callers to please clearly state and spell your name for the record prior to speaking and limit your testimony to 2 minutes.
To participate in public comment, please press star 9 now to take your place in the queue. With the caller with the last 3 digits, 084, please slowly state and spell your name for the record. You have 2 minutes and may begin. Caller with the last 3 digits, 084, please press star 6 to unmute.
Good afternoon, Chairwoman Wynn and members of the committee. For the record, my name is Tom, T-O-M, Wellman, W-E-L-L-M-A-N, and I'm a resident of Assembly Senate District 1. I've successfully retired from the Clark County School District and currently serving as president of the Nevada State Education Retired Program. I'm here this afternoon to make public comment regarding a very serious issue to retirees in the state of Nevada and our retired members, healthcare. One of the major expenses that all senior citizens and our members face in retirement is the continuing escalating cost of healthcare. Retirees that live in rural Nevada also face the additional burden of accessibility to quality healthcare that does not require them to drive over 2 hours or more to see a doctor or go to a hospital. Any measure that can be put in place to help curb this runaway train is greatly appreciated. NSCAR is asking that along with everything else that you're faced with, you make access to retiree health care a priority and address the rising cost of medication. However, please keep in mind that Nevada is a WEP and GPO state, and many of our retired members that desperately need this assistance may not qualify for access to either Social Security or Medicare. Please consider as you move forward that active educators and support professionals will also need to have access to quality, affordable health care when they retire. Working together, we can help solve this problem for the employees that can continue to handle these life-changing assignments on a daily basis. Thank you for your time.
Thank you. Do we have any other callers on the line for public comment?
Chair, the public line is open and working, but we have no more callers at this time.
Thank you. And with that, I will open it up if there are any comments from committee members before I adjourn the meeting. Seeing none, I will remind members we have another meeting here on Wednesday. We're trying to pack in a lot of bill hearings, and I know that we got a lot of last-minute draft bills that received our committee members. So please pay attention to your emails and mail us about like last-minute amendments, as it is that time of session. And with that, I will adjourn the meeting and see you all on Wednesday at 1:30.
Thank you, Madam Chair.
Have a good day.